My name is Okey, and this is Tori. We're both physical therapists here at Orthopedic Partners. We're going to go over a few things with regards to crutches. We'll start off with how to properly fit crutches when you're using them.
When patients come in for their initial evaluation, we're usually chatting with them, asking, how are you doing with your crutch or your walker use? Are you feeling comfortable? Do you have stairs at home that you need to manage? And if they are having a lot of trouble or something just isn't feeling right, we will initially address that right off the bat and make sure that they're fitted properly, make sure that they're ambulating properly with it, and address stairs if need be. You want to make sure that you're standing nice and tall with the crutches next to you. Ideally, you want to have the crutch on the outside of your arm here, resting. So where you want the crutch handle to fall is about 2 inches or about 3 fingers distance between the head of the crutch and your armpit area. And you want the handle of the crutch to line up just about your wrist. So that way, when you are holding the crutch, the elbow is slightly bent to about 30 degrees and your armpit is not resting on the head of that crutch.
Now, as far as walking with the crutches goes, there's a few different gait patterns that you would use depending on what your weight bearing status is. If you're going to be non-weight bearing through the right leg there, in order to start walking with the crutches are always going to go first. From here, you can either step to or through the crutches depending on how comfortable you are with them.
So that would be a step 2 pattern where you are advancing the crutches first and then landing in line with the crutch tips on the ground, or the step through pattern where you're advancing the crutch tips forward and then stepping all the way through the placement of the crutch tips as you are moving forward.
And then we can turn around and come the other way to demonstrate another pattern if you were toe touch weight bearing, kind of a progression from non-weight bearing. From here, the crutches are going to go first and the affected leg will come through and your toe can lightly touch down as you step again either to or through those crutches. Lastly, with the crutches, we'll go to weight bearing as tolerated.
So as you're walking here, you would put as much pressure as you're comfortable with through the affected side, advancing with the crutches and stepping through with the unaffected side.
And here the crutches always go with the affected leg.
As you're walking, you want to make sure that you're putting pressure through your hands and not through your armpits, because like Okey said before, if you are putting direct pressure through your armpits, you can cause some nerve compression and irritation on the armpit area.
One mistake that people typically make when they're using a crutch or some other assisted device on one side only is they tend to put it on the same side as the affected leg, whereas you would want it on the opposite side. That helps you maintain more normal gait pattern and gives you more balance. So in this situation right here, my left leg would be the affected side. As I'm walking, the crutch again is going to go with the affected leg. Using a walker is very similar to using crutches. This just provides much more stability, being that you have 4 points contacting the ground rather than just the 2. Sizing is going to be the same with regards to the handle. The handle is going to be in line with your wrist. Whether you're on the inside or the outside, doesn't matter. You just don't want to reach over the top to do the sizing. With this, we'll go through the non-weight bearing, toe touch weight bearing, and then weight bearing as tolerated. So first off, you move the crutch first, your non-weight bearing, and then you step to the walker. You want to be careful not to move the walker too far out in front of you so that you're not losing your balance.
To address stairs, you are going to keep a similar pattern as when you're walking. So Okey is going to travel upstairs. The key that we like to tell everybody is up with the good and down with the bad. Up with the good, you're going to step up with that unaffected side, progress the crutch tips forward to give you support as you are then progressing the affected side forward. So coming down the stairs, Okey is going to advance the crutch tips. You want to make sure you're being really careful, really cautious when you're progressing down the stairs. Down with the bad, followed by the unaffected side. So crutch tips are moving forward first, followed by the affected limb. Make sure you're nice and stable before progressing the unaffected side. You're gonna be a little bit sore when you're first using crutches because it's a lot of muscle strength coming from your shoulders and your upper extremities. Your body will adjust to that. You will adapt over time.
Doing this fitting properly prior to using the crutches can help to reduce some of that soreness. For instance, if you have the crutch too high, and you have too much bend in the elbow, that's going to require a lot more strength out of your tricep and get you a lot more soreness. So that appropriate sizing can help to a degree with that. In certain cases, some people may use crutches when they've sustained an injury and they've sort of self-prescribed those crutches. Whether or not they're needed, it's sort of up in the air, but if you've got a mild sprain or mild to moderate pain, slowing it down a little bit is going to give you better balance, help regulate your gait pattern, and help with your overall recovery. As far as compliance goes with assistive devices, sometimes people don't use the device at all for varying reasons. One could be they're concerned about what it looks like, or they feel that by pushing themselves harder, they're helping themselves to progress. While that may be true in some cases, it's important to know when that is, because if you're pushing yourself beyond what your current abilities are, then you might suffer a fall, which is then going to make you take steps backward in your recovery.
It can also cause you to just be more sore, more fatigued if you're progressing too quickly, which can also lead to you taking kind of 2 steps forward, 1 step back during your rehab and recovery. Whereas if we did a smooth weight-bearing progression, transition from walker to cane to getting you back to walking naturally and independently, that would make for a much smoother and easier process without the extra soreness and extra pain that it may cause.
Have you ever had to use crutches?
I don't think I have. Yeah.
Lucky you.
Yeah, you're lucky. I'm not as lucky. I had a knee surgery about 7 years ago myself where I was on crutches for quite a long period of time. So I am very familiar with crutch use from having to be a patient myself and go through the rehab progress and learn how to use crutches, learn how to get my function back and keep moving forward.